Hi guys, welcome to my presentation. Myself Ajin Shah. Today the topic of my presentation is some of the common topics which is related to angle in hip complex. First we can see about center edge angle of Weibuck. Definition. The center edge angle is formed by a line connecting the lateral rim of acetabulum and the center of femoral head and a vertical line from the center of femoral head. Features of center edge angle. Normal center edge angle is 25 to 40 degree. If the angle is in between 16 to 25 degree, it may indicate possible dysphagia. And if the angle is less than 16 degree, it may indicate definite dysphagia. And if the angle is more than 40 degree, may indicate excessive acetabular overcoverage. Next we can see about angle of torsion. Definition. It is an angle formed between an axis through femoral head and neck in the transverse plane and an axis through the femoral condyles. Features of angle of torsion. Normal angle of torsion in adult is 10 to 20 degree and it varies between males and females. In males it is 15 degree and in females it is about 18 degree. It decreases with age. At birth it is about 30 to 40 degree and it gradually comes to normal. Here also two pathological conditions happens due to changes in angle. A pathological increase in angle of torsion is called anteversion and a pathological decrease in angle of torsion is called retroversion. In this picture, you can compare the pathological increase and decrease in angle of torsion. Next we can see one of the condition, articular congruence. The hip joint is considered to be an articular congruent joint. In the neutral or standing position, the articular surface of the femoral head remains exposed anteriorly and somewhat superiorly. The acetabulum does not fully cover the head superiorly and the anterior torsion of femoral head exposes the substantial amount of femoral head's articular surface anteriorly. Here, the articular contact between the femur and the acetabulum increased in the normal non-weight-bearing hip joint by a combination of flexion, abduction and slight lateral rotation. Thank you all for listening to my presentation.